D patterns for PNF. Upper extremities. D1 flexion. The scapula is an elevation, abduction, and upward rotation. The shoulder is in flexion, adduction, and external rotation. The elbow can be in flexion or extension. The forearm is in supination. The wrist is in flexion and radial deviation. Fingers are in flexion. The thumb is in adduction and flexion. D1 extension. The scapula is in depression, adduction, and downward rotation. The shoulder is in extension, abduction, and internal rotation. The elbow can be in flexion or extension. The forearm is in pronation. The wrist is in extension and ulnar deviation. Fingers are in extension, and the thumb is an abduction. D2 flexion. The scapula is an elevation, adduction, and upward rotation. The shoulder is in flexion, abduction, and external rotation. The elbow can be in flexion or extension. The forearm is in supination. The wrist is in extension and radial deviation. The fingers are in extension, and the thumb is an extension. D2 extension. The scapula is in depression, abduction, and downward rotation. The shoulder is an extension, adduction, and internal rotation. The elbow is in flexion or extension. The forearm is in pronation. The wrist is in flexion and ulnar deviation. The fingers are in flexion, and the thumb is in opposition. Lower extremities. D1 flexion. Pelvic is in protraction. Hip is in flexion, adduction, and external rotation. The knee is in flexion or extension, and the ankle is in dorsiflexion and inversion. D1 extension. The pelvic is in retraction. The hip is in extension, abduction, and internal rotation. The knee can be in flexion or in extension, and the ankle is in plantar flexion and eversion. D2 flexion. The pelvic is in elevation. The hip is in flexion, abduction, and internal rotation. The knee is in flexion or extension, and the ankle is in dorsiflexion and eversion. D2 extension. The pelvic is in depression. The hip is in extension, adduction, and external rotation. The knee is in flexion or extension, and the ankle is in plantar flexion and inversion.